Anytime you're ready, Terry.
All right. Well, first of all, this is a very quick introduction. I just wanted to say hello to all of you and welcome you to today's session. This is the second in a series of sessions around diversity in care. So whether you are a student, an alum, or have some interest and are in the community and are joining us today, first of all, I want to welcome you and let you know that certainly Herzing is a part of preparing you for your next adventure in life. And that means that we want to be able to provide you with the tools to be able to have a diverse experience while you're here and certainly after you leave. We know that the patients that we see upon leaving are diverse in nature as well. So their requirements are going to be diverse. So we're trying to put together, in addition to your academic requirements, some other opportunities for you to engage and understand differences that exist in terms of not only patient needs, but also how we respond to those needs. So with that, again, thank you very much for spending some time with us today. And I'll turn it over to Dr. Galloway, who will present today on a different kind of approach to treating individuals. Thanks so much for being here.
Whoops, I was on mute. Thank you so much for having me. I just want to kind of start off by saying thank you to Aaron and thank you to Herzing for allowing me with the opportunity. And I'll go ahead and start the presentation. If you guys have questions throughout, please make sure to submit a chat or even kind of ask your question. I'm a very conversational person, so I like to have that back and forth camaraderie throughout the presentation here. So let me go ahead and start the show here. All right. So again, welcome to Essential Oils in Primary Care. My name is Dr. Christopher Galloway. For those of you that don't know, I'm a doctor of nursing practice, advanced practice registered nurse with full practice authority, full board certified family nurse practitioner, and a certified medical examiner. Also have my master's in online teaching. So thank you for joining us. It'll be an exciting journey that I hope that you will take away something that you can utilize in your practice as you go forward. All right, so a little bit of a disclaimer because I like to do this, especially with essential oils not being FDA reviewed and approved. As with all education opportunities, this course is not a substitute for professional licensure, and completion of this course does not authorize you to diagnose or treat any individual unless allowed in your scope of practice for your individual professional license. All information and content presented in this class are for educational and reference purposes only. This course should not be a replacement for guidance regarding treatment of any disease process discussed by a licensed healthcare professional. Prior to utilizing essential oils for any disease process, you should first discuss with your primary care provider. Information and statements made throughout this course have not been evaluated by the FDA, as the FDA does not currently regulate the manufacturing or recommendations made for use regarding essential oils and their byproducts. All right, so we have the disclaimer out of the way. So let's talk a little bit about what we're going to talk about today. As you may or may not be aware, holistic care is a growing trend in American healthcare. Many Americans are consistently seeking out alternative approaches to their care other than traditional pharmaceutical medications. Many alternative modalities sought after are essential oils, chiropractic services, nutrition regimens, supplements, acupuncture, meditation, yoga, exercise, strength training, and the list goes on and on. But with that being said, there's a multitude of resources available to the general public through the internet. The unfortunate part is that not everything you read on the internet is useful, beneficial, or even safe. I can't stress enough to you the importance of obtaining resources and education from reputable resources, as much of the information available to the general public is not evidence-based. So we really want to focus on evidence-based. I have a huge passion for working off the evidence-based practice. In light of this, this resource is very evidence-based. I'm going to provide you with a lot of references and can give you even more after the presentation. but you'll be able to take those resources and educate your patients on safe and effective methods of utilizing essential oils for all different kinds of things. All right, so with that said, we're going to define what essential oils are. We're going to talk about benefits and risks with some of these essential oils, summarize, essential oil use, compare how we can utilize essential oils in general practice and specialty care, and then sort of look at what might be essential oils you would use in your practice. So essential oil science. Before I jump into kind of talking about essential oils and what we can do with them in primary care, I like to talk about the history. Understanding the background is just as important as understanding what the future holds for essential oils. So regardless of your beliefs in a higher power, there is historical information on the benefits of essential oils. Essential oils are made of molecules called terpenes, among other molecules. And we'll talk about the basic molecular structure, a little bit of essential oils that you will be able to apply to your current knowledge with pathophysiology to better understand how essential oils will interact with the cells in the human body. We will also learn a little bit about the ways that essential oils are absorbed into the body with various grades of quality of essential oils and what they each mean in terms of safety, efficacy, power, and even hazards. And then we'll also talk about exploring the traditional use of essential oils and their relationships within modern research. So ancient use, right? Herbal medicine dates back thousands of years. As I previously stated, no matter what your belief in a higher power or your views on creation versus evolution, there are historical documents that outline the use of botanicals and their extracts as medicine. There's no one foundational source where the use of essential oils first began, and instead many documents exist from various parts of the world, lending to the collective foundation of essential oil usage, including in China, Egypt, France, Greece, India, Iraq, Syria, which was part of Mesopotamia, Switzerland, Tibet, the United Kingdom, and even in the United States by Native Americans. Among those documents, there were detailed accounts of the methods in which essential oils and botanicals were used for medicine, which included the stems of the plants, smokes, inhalants, fumigants, snuffs, salves, lotions, perfumes, waters, baths, and many more. For those of you who have heard about the three wise men, two of the gifts brought forth were frankincense and myrrh, essential botanicals, right? And there's a reason that they were brought forth. And to top that off, we know that frankincense is used for its healing powers and was more valuable than gold during ancient times, while myrrh is known for its skin healing and immune boosting properties. So it's kind of fascinating to think about that. And we just had a brief discussion before the presentation about frankincense and how sometimes the smell can be off-putting, but what such a powerful essential oil it is. As essential oil practice continued into the Renaissance period, there were three main influencers of the practice of using essential oils in medicine, including French chemist known as René Maurice Gattefossé, who coined the term aromatherapy in the 1930s, where he reinvigorated the use of essential oils in medicine by stopping the spread of gas gangrene with one rinse of essential oil of lavender. Think about that, right? Gas gangrene. All we needed to do was a wash of lavender and it stopped. He continued throughout his career to explore additional uses of aromatherapy in clinical practice. Another main influential pioneer in the Renaissance of essential oils was John Valnet, a medical doctor in the Army. He was the first medical doctor to publish a book in 1969 on the use of aromatherapy to treat medical conditions. Valnet is also quoted stating, "It is not necessary to be a doctor to use aromatherapy, but one has to know the power of essential oils in order to avoid accidents and incidents," which he did in an interview for the International Journal of Aromatherapy. The third influential pioneer was none other than a nurse by the name of Marguerite Maury, who identified the use of essential oils in many clinical settings, including surgery, radiology, dermatology, gynecology, gen med, psychiatry, spa treatments, physiotherapy, sports, and cosmetics. So she identified many different areas that aromatherapy could be utilized. And she also founded the first aromatherapy clinics in Paris, Great Britain, and Switzerland. So modern day, right? So we talked a little bit about the past. So these three pioneers have paved the way for the practice of aromatherapy as it is known today. Many people have the idea that aromatherapy means the aromatic properties of essential oils. However, there are many more components of aromatherapy other than aromatic use, including oral routes, rectal routes, topical routes, inhalation routes. However, it is crucial to be properly educated prior to practicing aromatherapy, which we're going to talk a lot about here shortly. But modern technology has also allowed for the creation of chemically similar mixtures that attempt to replicate natural botanical essential oils. I want to restate that because this is going to mean a lot to you. Essential oils in and of themselves need to be essential, right? If they are chemical compounds and we're passing them off as essential oils, we are setting ourselves up for those hazardous side effects that are occurring. There are three main categories of aromatherapy that we use in modern day: clinical aromatherapy, aesthetic aromatherapy, and holistic aromatherapy. Aesthetic aromatherapy refers to the enjoyment of the fragrance of the botanical essential oil, such as in perfumes. But in modern day society, there are actually very few perfumes and fragrances that do not contain chemical alternatives to natural botanical oils. So that's one example of how sort of this natural botanical has become chemically compounded and now is replacing those essential botanicals that once were used. Clinical aromatherapy refers to utilizing essential oils to target a specific clinical symptom, as we will soon discuss, like nausea, mood, and special populations. Holistic aromatherapy refers to a blend of essential oils used to treat the mind, body, and spirit of an individual. This type of aromatherapy is often utilized for massage therapy and other relaxation treatments. So while many of us are like, oh, I don't know if I can use essential oils in practice, I don't know if it has a place, can I not? When you stop and think about it, it is something that you are using every day with or without direction from a primary care provider or a provider in general. There we go. All right, so we talk a little bit about what its use is. Let's talk a little bit about this. Now, these sort of chemistry of essential oils, we're going to talk about it briefly, but it's something that not only will make you sound educated, but will also actually educate you. I don't expect you to memorize all this or remember all of this, but just a little bit about what essential oils, how they're derived, right? They're named using botanical taxonomy derived from the Latin language, which is very often common in healthcare. But while this may seem a bit daunting, it is important to know because it will definitely help you identify the specific botanical species that the oil was obtained from. For instance, there are many species of chamomile, and each species provides different results with use. For instance, let's look at the differences between German chamomile, which is Metricaria racutica, and then it's dark blue and it's useful for skin and inflammation. But then we look at Roman chamomile. So we have German chamomile, then we have Roman chamomile, which is Chamomilium noble. It's a pale yellow. It can be blue, but it's typically a pale yellow, and that's beneficial for sleeping and muscle spasms. And then we have Moroccan chamomile, or Orminus mixta, which is has minimal antibiotic properties and is mainly used in perfumes. So it really depends on what part of the plant we're utilizing and what species of the plant we're utilizing. That depends on the use and function of that specific oil. We can even take it a step further and explore the different functional groups of terpenoids and non-terpenoids, which is the exact chemical makeup of the botanical essential oil. Which you'll see here on the screen, there's kind of this benzene ring. That's the aromatic ring that sort of produces the properties of that oil. We'll not go into full detail, but you should know that essential oils are made up of terpenes, monoterpenes, sesquiterpenes, diterpenes, all your terpenes, your alcohols, your sesquiterpenes, ethers, aldehydes, esters, ketones, all of these good scientific things. But aside from the chemical makeup of the aromatic rings, it's also important to note how essential oils are produced. How they're produced is just as important as utilizing, true essential oils. The primary methods of extraction of essential oils are from oils from botanicals are steam distillation. You can also do expression, enfleurage, CO2 extraction, and even solvent extraction. So steam distillation requires high heat but a low level of labor. This method is viewed by many aromatherapists as beneficial, but if performed improperly, leaves the essential oil without the chemical properties to make them useful. For instance, steam distillation, if we get it too hot, we will denature the essential oil properties and we just become just a smelling water. which is also called a floral water. And where we see floral waters primarily used is in perfumes. By aromatherapy standards, these essential oils are typically not used therapeutically, with the exception of some steam distilled floral botanicals. Expression is an extraction using high pressure, and this is the main way of producing citrus essential oils. So we use high pressure in the rind of the citrus fruit, and that is how we obtain citrus fruit oil. You know, we think of oranges, and a lot of people think that the juice from the orange is what the essential oil is, but that is really not the case. It comes from the actual rind itself. You know, aside from, let's see here. So essential oil extraction. Yep. So we were talking about extraction. All right. The most common variant or addition of kind of pulling extractions out enfleurage, right? Enfleurage. It's an ancient way of producing essential oils that uses an animal fat layer to absorb the essential oils when the botanical is heated at very low temperatures. This is a very lengthy process, though it does produce one of the best whole essential oil, or maintaining all of the components that we will need. And then CO2 and solvent extraction are primary ways that therapeutic essential oils can also be created. Knowing this, you'll want to ensure that the essential oils you're using are properly obtained from botanicals to determine their therapeutic potency. The most common variant is the addition of cheap chemically produced oils or cheaper oils like corn oil to dilute the oil, or even vegetable oil. So I want to be cautious about that. Not all essential oils are created equal, and it's very important to know where your oils are being sourced and how they're being processed. And so you know, a lot of times we think about being sourced and we're like, oh, it comes from a reputable place. But think about these farms and fields. These are botanicals. How often do we see pesticides used? Are we harvesting the plants that we're utilizing for our essential oils coming out of fields that have had pesticides used? And so I challenge you to think about that for a second. So the oils that you're getting are coming from something that has had pesticides on them. We can't eliminate the pesticides out of the plant once they're absorbed into the plant. So so I just caution you. I've used essential oils from a few different places, but always researching the oils, always looking into purchasing as holistic as I can. And I can give you a list of essential oil companies that I've used in the past, as well as some essential oil companies that I would strongly urge you to do further research on prior to using. So we talked a little bit about the absorption: topical, inhaled, internal, and oral, right? Topical is the most common clinical use, and we use this for relieving localized trauma such as bruising, sprains, stings, and burns. Some of the oils that we'll use for bruising are things like helichrysum. Sprains and stings and burns, we'll use things like peppermints or wintergreen. And we can also do some relaxing and warming of specific muscles. We can also use topical for antivirals, antifungal, and antibacterial agents for skin infections, and also use for a general body relaxing. Now, I want to tell you that a lot of essential oils, while some of them can be very safe to be applied to the skin topically, there are very potent oils out there that can cause burns on the skin. So you will want to use a carrier oil, something like a coconut oil or some type of cold pressed oil, to combine with your essential oils for safe use. This is especially the case in pediatric populations. So if we're going to be utilizing essential oils topically for pediatric patients, we will want to make sure that we are diluting those. And the amount of use depends on how much it's diluted, how much volume we've applied, how much surface area we are treating, and what carrier oil we're using. So a lot goes into the topical component, but the best rule of thumb is, if in doubt, dilute, okay? Usually a 2-to-1 or 3-to-1, and with peds a 5-to-1 ratio. Another method is inhaled. Upper and lower respiratory tract infections, sinusitis, headaches, asthma, depression, fatigue, nausea, insomnia, even nicotine or drug withdrawal, and even post-traumatic stress disorder. So a lot of us have sort of heard about some of these things as far as lavender, right? And helping with calming. And we see these these bath bombs or these relaxation products that all say, Roman chamomile and lavender, and they're all of sort of these things that will help our minds relax. And there's actually science behind why we choose those oils and what chemically happens in the body with the receptor sites. So inhaled is one of the most common ways that we see. Internal is one of the most often underutilized method of essential oil delivery, right? A lot of people are like, I'm not putting that in my body, or they're scared, they don't know what it is, right? But direct application to the problem area. So for example, we can use essential oils for sore throat, dental problems, gingivitis, yeast infections, bronchitis, just to name a few. And we can either do them through mouthwashes, gargles, creams, suppositories. There's multiple different methods that we can get them internally utilized. And again, the amount used depends on the desired clinical outcome and the method of delivery. Certain essential oils are considered hot oils and can be irritating to the skin if not used properly. So if in doubt, again, we're going to dilute that with a cold pressed oil like an avocado oil or grapeseed oil or jojoba oil, coconut oil, one of those. Essential oils are excreted through the kidneys, lungs, and skin. This is important to note, as additional attention and care must be given to individuals who have renal, lung, and dermatological insufficiencies. More research is being completed to determine exactly how essential oils are excreted, as there are not many studies that look at the excretion of oils, really just the benefit of oils. However, it is important to note that many studies exist that show increased level of essential oils in the blood after topical application, lending to the benefits of topical application, that it's absorbed quickly into the bloodstream. Now that we have better foundational understanding of the science of essential oils, we will explore the foundational underpinnings for the utilization of essential oils. We'll discuss the varying methods of delivery of essential oils, including a little bit more about the aromatic, topical, and internal. And then we'll also explore how aromas affect both the mind and the body, right? We talked a little bit about the mind with the lavender, but we're also going to talk about the body. And I believe that we can all agree that the mind is a very powerful thing, and the mind has power over the body, as in the age-old adage of mind over matter. And you'll find that some essential oils are used to stimulate the mind to empower individuals to stretch themselves to optimal outcomes. However, essential oils are not just used aromatically for the stimulation of the mind, but also utilized through touch and massage, with touch being one of the most powerful tools we have as healthcare providers and human beings, right? Touch is so crucial. Which is very hard in the current times we live in with the COVID-19 pandemic. Essential oils can also be used for aromatic medicines, and we'll explain that here in just a moment. So as I previously stated, not all oils are created equal, right? When you invest in high quality therapeutic grade pure essential oils, it means that those oils are highly concentrated and should be treated with respect. It is also crucial for you to be properly educated on any essential oils you are using, as well as the importance of storing your oils safely. It is important to store oils away from children and treat them as you would any modern pharmaceutical. Many essential oils manufacturers also place child safety caps on oils that can cause serious injury if consumed by a child, like pure wintergreen and oregano are very hot oils, and they're not safe to come in contact with children, especially topically, but internally it can be much worse. So we want to handle them with respect. And it is recommended to perform an essential oil patch test, right? Essential oil patch test on the skin prior to utilizing the essential oil on a large dermal surface area. So we want to make sure that we're doing that. And proper storage with oils, you're going to notice that most of your oils are coming in a dark amber or blue, a dark green vial. And that's because we also want to protect most of our oils from sunlight. Sunlight will denature the chemical property of the actual botanical itself. Some of the more common safety concerns are in relation to excess oral consumption and then dermal irritation. These toxicities require specific methods of treatment to avoid long-term complications. If an essential oil is topically applied that results in skin irritation, it is important to note that you do not wash off oils with water, right? Oil and water don't mix. And so if you have an oil on your skin and you apply water over the oil, what's going to happen to the oil? It's just going to drive deeper into the skin. So we want to make sure that if we get it on the skin and we got some irritation, we want to apply over top of that a carrier oil, something like the coconut oil, jojoba oil that we talked about. And that will help to dilute the oil that's on the skin and help disperse it to decrease that dermal irritation. The other thing that's important to note is that some essential oils, especially citrus oils, are photosensitive, right? You're going to see on the screen here, this is from a sunburn that was caused by the application of citrus oils. And this sunburn occurred because they applied the oil and then went out in the sun, and it makes the skin very photosensitive. So we want to make sure that if we are using citrus oils, that we're using them when the sun is not out, when we're not going out in the sun. And if we are, that we need to make sure we are putting ample amounts of sunscreen on. Speaking of sunscreen, here's the chance for me to throw this in because I don't believe that I have it in the rest of the presentation, but carrot oil. Carrot seed oil is a great alternative to sunscreen. Just to throw that out there. So while there are very few oral overdoses of essential oils that have been documented resulting in renal toxicity, it is important to note that individuals with renal problems should avoid wintergreen essential oils, wormseed oils, and pennyroyal oil. So those three we want to make sure, right? And so wintergreen essential oils, how many of you have patients or even family members who have some type of kidney disease, but they chew gum all the time and they're chewing wintergreen gum? Right? Have you thought about that? So I would challenge you, think about these things, right? Just because it's not a pharmaceutical, and just because they're not taking an essential oil, we want to see, is there truly that essential oil in that gum, and are we absorbing it? Because we can cause some renal issues. If essential oils are mistakenly consumed that should not be consumed, or consumed in excess or other improper consumption by a child, you should contact your poison control center promptly. One key thing to note about this is do not induce vomiting, right? We do not want to induce vomiting and call poison control. Lastly, it is also important to note that some essential oils have interactions with modern pharmaceuticals. So again, not all oils and pharmaceuticals play well in the sandbox together. Individuals who take medication which interact with cytochrome P450 enzymes should be avoided. They should avoid lemongrass, lemon myrtle, lemon scented tea tree. Pretty much all of your lemons, also palmarosa, German chamomile, blue tansy, and yarrow. So if you're taking any medication which interacts with cytochrome P450, be cautious of those oils. And then individuals taking blood thinners such as warfarin, aspirin, or heparin should avoid essential oils capable of inhibiting platelet aggregation, which is star anise, holy basil, sweet fennel, oregano, right? Yep, I said that. Warfarin, Coumadin, those folks should not be consuming oregano in high quantities, right? Because it will help, it's going to inhibit platelet aggregation even more. And so they will sometimes see higher PTINRs. Individuals taking MAOI inhibitors should avoid oral consumption of clove, cinnamon, cinnamon, no matter what cost or what form of cinnamon, whether it's the bud, the leaf, the stem, the bark. If you're taking an MAOI inhibitor, you'll want to avoid cinnamon altogether. Individuals with diabetes, we would want to avoid Chinese cinnamon, fenugreek, geranium, which is one of the oils that the smell I just can't handle, but some folks like it. But fenugreek, geranium, turmeric, right? We see a lot of turmeric coming about in this modern day advancement into looking for more holistic care. But people with diabetes should avoid turmeric because they can have anti-diabetic effects, which increases the risk for hypoglycemia. Aniseed, we also do not want to use in conjunction with any diuretic. And then individuals with epilepsy need to avoid certain oils. This is a big one, especially with our kids. You know, some of the things that we need to avoid with our kids with epilepsy or adults with epilepsy, pennyroyal, which isn't one of your more common, but some of your more common oils are going to be rosemary, your tansy, your wintergreen, your fennel, peppermint. Peppermint is an oil to avoid with epilepsy. Another common vulnerable population to consider with the use of essential oils are pregnant women. Some of the essential oils that we want to avoid in pregnancy are anise seed and star anise, cypress, dill, fennel, right? Dill, right? Dill pickles. How many pregnant people do you know eat dill pickles? We want to be a little bit cautious about that. Fennel, hyssop, and even Spanish lavender. As always, I do recommend that you consult with your medical professional provider prior to utilizing essential oils in your healthcare. So integrative healthcare sometimes is used synonymously with integrative medicine, is a platform of delivering care through multiple modalities, including modern medicine with complementary and alternative medicine approaches. So as I mentioned at the beginning, Holistic care is a growing trend in American healthcare, and individuals are always seeking out knowledge, education, and guidance of alternative therapies aside from traditional Western medicine that they can do at home. As such, the use of essential oils, now known as aromatherapy, is one of the many complementary and alternative medicine approaches to clinical care. And CAM is broken down into three main categories of natural products, mind and body practices, and other health approaches. Aromatherapy is not explicitly assigned to any one of the categories of complementary alternative medicine, but could easily fit into any of the three. It's important to note here, though, that essential oils and aromatherapy are not a replacement for modern medicine approaches to care, but rather a complement to modern medicine. So what about in the United States, right? We see a lot of essential oils across the globe, but what about in the United States? Clinical aromatherapy via integrative health is a growing trend here in America, and approximately 30% of academic healthcare organizations offer some component of aromatherapy. However, there is a concern over reimbursement from insurances, which has led many of these organizations to adopt alternatives to third-party reimbursement, such as medical insurance. Many of these organizations are offering aromatherapy as a fee-for-service treatment, which requires the individual to pay directly for their aromatherapy versus submitting to third-party payers, as most, if not all, third-party payers do not reimburse for aromatherapy, as I had stated. In the United States, aromatherapy is currently being used primarily for oncology, cardiovascular, menopause, pain management, and osteoporosis. In fact, Dr. Jane Buckle, who's a PhD registered nurse, developed and taught the first certified clinical aromatherapy practitioner course in 1995. And since then, that course has been endorsed by the American Holistic Nurses Association as the first aromatherapy course endorsed by a professional nursing organization. So and that course has been taught in over 27 states. Clinical applications of aromatherapy have been integrated into several organizations, many hospital settings, including in North Carolina, New York, Minnesota, Texas, Utah, Illinois, and many others. So we're starting to see more and more essential oils being utilized primarily in the inhalation method within the United States. But as we look across the world, right, what does worldwide integration look like? And it integrates across the globe. United Kingdom, it's super accepted in the United Kingdom, and that kind of, at first I was like, wow, that's we fashion a lot of our healthcare very similarly to the UK, and so it was interesting and fascinating to me that aromatherapy is widely accepted and utilized. So the first utilization and publication on the use of aroma sticks were first used in the clinical setting in Manchester, United Kingdom. London also was the first to use aromatherapy diffusers in the clinical setting. And in Leeds, United Kingdom, where clinical aromatherapy obtained its foothold in palliative care. In South Africa, they're known for their aromatherapy for the implementation of aromatherapy in pain management. And without argument, China has been using botanical extracts for many of centuries to treat a multitude of clinical symptoms and diseases. And so then we start to see that clinical aromatherapy is growing and widely utilized in Australia, Belgium, Brazil, Canada, even Croatia, Finland, France, Germany, Greece, Iceland, Ireland, Japan, and the list goes on and on. It's also important, and I want to note this, that worldwide integration, right? We talk about the use of essential oils, but what we're seeing across the globe is this integration into primary practice and essential oils being prescribed by medical providers, which we'll talk about here in just a moment. But integration into your practice. So here's a couple of pictures of my office. As you can see, I have lots of essential oils hanging out up there. It's not something to take lightly, though. You must take the time to educate yourselves, as well as uphold a commitment to educate patients in the community at large. In my practice, we proudly display essential oils that we both educate on as well as use during office visits. So there are some patients, they come to see me just for the complementary treatments. And so we talk about them, and I educate them. I give them information on where to go to get their resources so that they are educated properly on safety and efficacy. And I am actually really proud to offer complementary alternative medicine, and essential oils being one of them, in the clinic. And I think it's really powerful to the community at large to know that there are alternatives. It's also important to note, and again, I've said this probably 30 times already in this brief 40 minutes that we've been together so far. But essential oils are not regulated by the FDA, just like other things that we will prescribe. This is where sort of my aha moment came back 5-6 years ago. I've been using essential oils for 20 years, but as a provider, I always was cautious to utilize them and recommend them because they aren't FDA approved. But with that being said, I want to ask you a question for my providers out there, my future providers, and even for my non-providers. Have you ever used a multivitamin? Right? A multivitamin, there's different brands out there and different formulations. Are those
Yes.
multivitamins FDA approved? They're not. They're not approved. Do medical providers prescribe them? Yes. So if we can prescribe a multivitamin, why can't we prescribe an oil? Right? That was my aha moment. It was like, whoa, that blew my mind. Even pharmacies, they'll dispense multivitamins that are not FDA approved. So what makes those multivitamins more important than the essential oils that we can utilize? So if you're recommending multivitamins and you're recommending dietary supplements, why not educate and recommend on essential oils? There's a study that I had dove deep into as I was conducting my study on essential oils and pain management. And the study was really the reasoning behind why providers don't prescribe essential oils. And that is because in school, we teach multivitamins. We teach about multivitamins and the different components of them and how they interact with the body. But we don't teach essential oils and how they interact with the body. So providers feel confident in prescribing a multivitamin because they've been educated. They don't feel confident in prescribing an essential oil because they haven't been educated. So the key thing is, where does that education fit in? Right? When would they learn about it? How do we get this education out to them? But just food for thought as you ponder if it's okay to stock, use, or even sell essential oils in your practice. So let's talk about some of the clinical use. 5 most common conditions treated with essential oils are infection, insomnia, nausea and vomiting, and pain and inflammation, as well as stress and well-being. To date, there are a multitude of essential oils claiming to help with specific problems, as well as essential oils that help with a multitude of problems. Just as in traditional Western medicine, there are multiple medications within a single drug class and even multiple drug classes to treat a specific disease. So we can kind of break essential oils down much like that. Take, for instance, medications used to treat blood pressures, right? We have ACE inhibitors and beta blockers, diuretics, and among others. And each of these medications serves a specific purpose and works in a different manner to help control blood pressure. The same is true of essential oils. One of the ones that comes to mind is something like frankincense, right? We use frankincense for infection. We use frankincense for pain and inflammation. We use frankincense for stress and well-being, but they're going to impact the body in a different way depending on how we're applying them, either topically, orally, inhaled. Frankincense is great for infection, right? We also can utilize peppermint for infections, and we can use lavender for insomnia. But we wouldn't necessarily want to use a citrus oil for insomnia. Citruses are very invigorating, right? So if you're down and you're feeling sad, one of the biggest thing, is stress and well-being, and we're just kind of that ho-hum, right? The winter blues, like I like to call them. Citrus oils will be a great friend of yours. They're very uplifting, they're very energizing, and kind of will get you going. So many different options out there as to what we can do. And I guess the question that I would ask you is, do you know how to use essential oils for these things? Again, these are the 5 most common reasons that patients seek out care with complementary alternative medicine. And so we need to be prepared to talk about them. We go to insomnia, we talk about Roman chamomile, lavender, nausea and vomiting. What do we use for nausea and vomiting, right? Ginger. Ginger is a great one. We always tell people that are having nausea and vomiting problems, ginger oil or ginger ale, right? Send them to ginger ale. Well, why not use ginger essential oil? Just food for thought. And then peppermint, right? Peppermint's a good one for nausea, but not for pregnant women. Pain and inflammation, again, we're trying to kind of heal the skin. And that's where frankincense really comes into play. But with inflammation, peppermint's another great one to kind of help give that numbing effect. And stress and well-being, I could give you 300 different oils and they would all be kind of treating a different thing. But lavender is one of the key go-tos for stress. Lavender, the other one that's good for stress and well-being is lime, surprisingly. Lime is one of the best citrus oils for that. So where else do we use essential oils, right? We use essential oils for the care of the elderly, critical care ICU. There's a couple hospitals out in New York that are using lavender diffusers in their ICU. And some of you may ask, well, what about allergies to lavender, right? Most of our allergies that we have come from pollen or come from the stem of the plant. And keep in mind that this is where I go back to making sure you know where the oils are coming from, right? And in most cases, if you're getting a true holistic essential oil, it's going to come from the leaf of, or from the petal of the flower, not from the leaves or the stems. They're going to be cold pressed, so we're not going to have any pollen transmission. And so we find that most of the time, people who are allergic to certain plants are not allergic to the essential oil of the plant if it is harvested correctly. So again, there's a lot more that goes into that we could talk about, but note that we are utilizing them in critical care ICU. Dermatology, we use a lot of essential oils in dermatology. Look at your facial products and see if there's essential oils in the facial products you're using. So why not use the actual oil itself for higher potency? Mental health, oncology, pediatrics, respiratory care, women's health, right? There's a couple of hospitals out in California that are utilizing essential oils, Eucalyptus radiata, Eucalyptus globulus, and breathing treatments to help with chronic bronchitis, to help with asthma. And then we're using it in women's health.
Hey, Chris, real quick
Yes.
question. You're talking about allergies to some, like, to some of the oils. What about the carrier oils? So if you've got, like, you get coconut oil and you got people with tree nut and peanut allergies.
So that's where there's the benefit of having multiple different types of carrier oils. I do caution not necessarily the essential oil component, right? I think that allergies again come from pollen and stems, but when it comes to the tree nuts, coconut, right? So I would recommend using a jojoba oil or utilizing a grapeseed oil for those that have nut allergies. Because you're right, absolutely. We can have the allergies to the carrier oils as well. And so we need to be cautious about that as well. And so that's why education is so important, right? And it's having these conversations with people who've gone through certification courses and trainings to be able to kind of navigate people through this. But if you don't think about it, or you don't realize, hey, I'm not eating a nut, but I'm going to touch coconut, maybe we will have some issues, right? And coconut oil typically will come from the flesh of the fruit, or coconut being the fruit, right? It can come from the flesh of it. But if we're allergic to coconut, what portion of the coconut are we allergic to? And do we really know, or do we just steer clear of coconut altogether? So yes, good point to bring that up.
Also, can you clarify? Do you have what essential oils are on your wall? There's several chats.
Ooh, I can't see the chat when I'm in the presentation. I'm so sorry.
That's fine. So it's like Young Living, doTERRA. They're wondering if those are on there.
I have used Young Living. I have used doTERRA. I have used some, not all. I have used some of essential oil brand called Now, which is sold a little bit more commercially in Whole Food stores. I will caution you. This is how you can kind of know whether your essential oils are good or not. If your essential oil says on the bottle, not for internal consumption, I want you to strongly consider and do your research on that essential oil as to whether or not you should use it. When we diffuse essential oils, we diffuse them into the air, not as steam, but as droplets, right? It's a cold diffuse. It is not a humidifier or a heated diffuser. So it's a cold diffuser. Those droplets are then going to the air. If we are smelling it, we are consuming it. We are putting it internally into our body. So if your bottle says not for internal consumption, I'm not really sure what you're going to use that oil for. And so I challenge each of you to look at the back of your bottle and kind of see for internal consumption, not for internal consumption. Now that's a rule of thumb 90% of the time, because there are some oils that cannot be used internally. Due to their hotness. And even if we dilute them, there's still a risk. But like frankincense essential oil, if you have frankincense, if it says not for internal consumption or do not come in contact with skin, that's my favorite. I don't have the bottle with me. It's actually at my office, but I do have a bottle of lavender essential oil that I obtained from Walmart. And on the back of the bottle, it clearly states do not come in contact with skin, not for internal consumption. What do you do with this? I'm really confused. So again, that's that education component that I really want to make sure that I'm putting out to everybody. Two of the biggest brands that we hear of are going to be doTERRA and Young Living. I have doTERRA, Young Living now, there's one other one that's newer to the market. I will come back to that, but yes, so there's multiple different methods, and I'm not going to say that one is better than the other. I think that doing your research, there are, benefits to all the different brands depending on what they're sourcing. There's certain, and again, I'm not promoting one over the other, but there are some of your major brands that we've talked about that in some of their fields, they don't use pesticides, and in other fields, they use pesticides. Well, are they distilling them in the same factory? Are they cleaning between distillation, right? Are they open with which fields they're using pesticides in, or which fields they're hand weeding in? So I think that's important to kind of note. Does that answer your question, Erin?
Sorry, yes. I muted myself and I couldn't get off of it fast enough.
No worries. I figured out a way to get back to my chat here. So that was a beautiful thing. Hospital in Hawaii that started using essential oils prescribed on a cotton ball during labor as a method to aid with anxiety and pain. I'm so glad you said that, because I actually just read about that not that long ago, Jessica, about how they are utilizing it in women's health. And that's kind of why I added women's health to the end of that slide, because they are. And then we're going to talk about, Amy, doTERRA, Young Living, both MLM companies, companies not associated with MLM. We can talk about that. And I'll talk about that when we get to the questions. I'm going to finish up here for just a second on policies and practices, and then we'll open it wide up for you. So you have a little bit more knowledge on some of the essential oils that we use for different things and why we can use essential oils, how we can use them. It is really important, though, to understand that due to public desire for more holistic care approaches to treatment, new essential oils are being developed all the time. New companies are coming out. There's branches of companies coming off of other companies that are utilizing essential oils. So this really requires ongoing education and an understanding in order to put them into practice, just as is the case with traditional Western medical approaches to care, right? We've got new pharmaceuticals coming out all the time. We're constantly learning about the new pharmaceuticals. We have drug reps and we have pharmaceutical reps that are coming around talking about their products, and where are these folks coming to the clinical setting to talk to us about the new essential oils that have come out? So I think it's important to note that if you want to use complementary alternative medicine in any realm, essential oils, acupuncture, yoga, you need to be educated and continue the education independently, because there's not many people that are going to come to you to promote their product in those realms. In many Eastern countries, there are governing bodies and associations that regulate the nature of education surrounding the use of essential oils. However, this is not the case in the United States, especially in regards to a lack of regulation, again, by the FDA. The fact that essential oils are not fully regulated by the FDA does not mean that you cannot implement them into practice. It merely means that you will need to ensure you are properly educated and trained to use them safely. After all, we have a duty to do no harm. So we will, we talk about the different types of oils and the different way we use them. And there's even some manufacturers who supply oils that are pre-blended to take kind of that guesswork out of blending. I know doTERRA has a lot of information coming out based solely on the clinical provider and how clinical providers can utilize them. They are one of the sort of pioneers of getting oils into the hands of providers in the US market, but they're not the only ones. And several are following suit with that. One of the best ways that you can educate yourself and know that you're educating yourself properly is to make sure that you are taking courses and certification courses based on the American Holistic Nurses Association or sponsored by the American Holistic Nurses Association. And if you have questions about essential oils and the safety and the efficacy, I encourage you to reach out to their aromatherapy hotline that they have. So with that said, I'm going to try to go back through all these questions. AromaHead Institute, there is a teacher training program. I do like AromaHead Institute. I have gone through that program. I do like it. I think some of it is very pertinent, and I think that at times there's some disconnect with what the new research findings are. So again, just like when we went to school, we learned out of one textbook, and now we're done with school. We're 5-10 years out, and things have changed. So we need to make sure that we are constantly staying up to date and not saying this is what it was 10 years ago and it's still that way today. Research has evolved and evidence-based has changed, across the spectrum. Let's see here. So, do you have recommended brands? Okay, so recommended brands, we talked about that a little bit. There's not any one specific one that I would tell you use this one. And I know that might be a little bit frustrating because I'm like, just tell me what to do and I'll do it. It's going to require some research. Again, that American Holistic Nurses Association, great place. They'll have some great ones. And then again, AromaHead Institute is a great one. They have several of resources for different brands. So I can gather a list of brands and kind of what I use in the office. I do have a document that kind of outlines more oils for what purpose. And then there's also a link to each one on the evidence base behind why I use what I use. Because again, with it not being FDA approved, if for some reason someone was to come back to me and say, why are you using this? I need to make sure that I'm evidence-based. So I do have a document that will outline that. I can get that over to Erin and she can send that out after she reviews that. Children's Hospital. What children's hospital do you work at, Lisa?
Strong silent type. It's okay.
No, that's okay.
I know when I was pregnant at Aurora 6 years ago at the Women's Pavilion in West Allis, they used the aromatherapy for my spinal headache during my labor.
Okay.
And it definitely, when the narcotics were not working, that did help.
Yeah. Yeah, no, exactly, right. And some of it is just helping to calm the mind and slow down the neurosynapses that are occurring, and to help with the affinity of the receptor sites. So it definitely it works. It's scientifically based. This isn't just a guessing game where we're like, oh, hey, this oil smells good, so let's use it. No, there's definitely a component of pathophysiological changes within the body when we inhale these oils, because again, when we inhale them, we're not just inhaling a scent, we're inhaling droplets that are then going to interact into the body. Yep. So most of the ones on the wall are Young Living in the office, but they're interspersed with a couple others. I tend to lean towards that brand only because I have actually been to several of their fields. And I have actually helped to weed some of their fields, which is really a fascinating thing to watch the process from start to finish. But again, that is not the only brand out there, and I don't want it to come across as though that's the brand you should utilize, because there are many alternatives that I think are just as effective. So we'll get that. MLMs. I do want to talk about MLM companies in healthcare for a minute. MLM companies, right? It's a kickback, right? That is what we have to be cautious of, is the Stark kickback law. We need to make sure that we are not violating any of that. But I take this a step back, and this is what a lot of the sort of political banter is behind MLMs and utilizing them in clinical practice is we purchase products from, maybe we network with Metagenics, right? Metagenics. We see Metagenics in a lot of chiropractic offices. We see it in a lot of functional medicine offices. You'll see it in my office. Again, what is Metagenics? Metagenics is a multivitamin and similar concept line that then patients can buy. When they buy it, do you make a profit? And if the answer is yes, then why can't you utilize an MLM? And where the gray area is in an MLM, just to kind of give some clarification, and it is a gray area, is signing people up for residual income. That's the gray area of an MLM. So if you are purchasing essential oils through an MLM company and selling them at wholesale or selling them at retail to your patients without requiring them to sign up for a distribution type thing, then you are literally just going from A to Z. And now I will tell you that Young Living has that type of account set up just for clinical practices to avoid any confusion with the Stark Law. And so they will sell them to you at wholesale prices, and you will sell them at retail prices, or what you choose. There is a threshold that some of the companies give you as to how cheap you can make them. And you cannot sell them at cost, although I would love to, because I am not trying to make money. I'm just trying to get them into the hands of people. But there is some. So that's where the gray area is on MLMs. And I'm glad that you guys kind of pointed that MLM thing out, but I do want to let you know just to be cautious of having patients signing up for residual income for yourself. That might come into some issues with Stark. So I would recommend, talking with your attorney, your legal counsel, if you have any further questions about that, since I don't have a legal degree. Aromahead Institute, yes. Through aromatics, I know a little bit about the oils through aromatics. I can't speak to it fully at the moment. I need to make sure that I do a little more research on that one. But if you can vouch for that one, I mean, I definitely will look into it, and I appreciate that feedback. Lisa, she works at Children's Hospital of Wisconsin, so it's great. We're seeing that this is coming closer to home, right? And for some of us, it is home. And so if we can use these in hospitals for these severe conditions, why can't we use them for conditions that are not that severe, right? We think about that, right? We're using them on spinal fusion patients. So why can't we use them for somebody who has a cough? But we're so afraid of it in healthcare to go, I can't because the FDA says I can't. The FDA also says you can't do multivitamins, and yet we still do. So I know we're coming up on that 1300 hour, my military timing, but so I know some of you have to jump off, but I am more than willing to stay and talk. And if you have questions, ask away.
I'll ask, what are the most typical, it's hard today. I don't know. It's Friday. I don't want to work anymore. What are some of the most typical conditions that you treat with essential oils?
Pain is a big one, right? So when I was getting my doctorate, I did a doctoral research study on the benefits of essential oils versus opioid pain medication in the management of chronic pain. That was my doctoral research, and we looked at peppermint, copaiba, and black pepper. And so I have actually taken those three oils and have combined them with a lotion base, and have created a sort of tiger balm type thing for topical use for pain. And I will tell you that I have actually been able to reduce opioid use with the use of these three oils in a lotion base. Copaiba, Amy, the three that I studied are copaiba, black pepper, and peppermint. I'm sorry. So those three things, in combination, I will tell you black pepper is a hot oil, and you'll utilize the least amount of that because it is a hot oil. Peppermint, it can also be a hot oil, so I want to be cautious about utilizing that. I use a 3-to-1 ratio of copaiba at 3, peppermint at 2, black pepper at 1. And then I'll use that combination of 6, right? And do a 6-to-6 ratio or a 1-to-1 ratio of all my oils to my lotion base. And that is what we utilize for topical pain medication, or pain relief, I guess I should say, because it is not a medication, but for pain relief. And there are many patients, if you were to start utilizing that, people will absolutely come back and say, hey, do you have any more? I need more. Especially your arthritis patients is what we saw it the most in, was our arthritic patients. with helping to decrease inflammation. I want to do another study and kind of, even if it's an informal study, on adding frankincense into the mix of that for the anti-inflammatory properties. Black pepper, copaiba are great for anti-inflammation, but then we're missing, we're relieving the pain, we're decreasing the inflammation, but we're not really helping to reverse or assist in the actual underlying cause with these 3 oils. And so if I add in frankincense, I just wonder what the longevity is, and it's a big undertaking to do that, but I really think that would be something worth studying, and we see so much about it. Any other questions? Did that sort of answer the question? Kind of. A lot of pain and inflammation, a lot of stress, anxiety. I have a patient who served in the military, 2 tours in Iraq, and she had gotten on Xanax and was taking 3 1 milligram tablets a day, and would keep coming back in and going, they won't write me more. I need more. These aren't working. What can I do? And so we sat down and we sort of created a blend that sort of met her needs as far as her anxiety, her PTSD, a lot of lavender, a lot of chamomile. But yeah, we hid some lime in there because her PTSD brings her down so much that she needs a little bit of energy. And so we're trying to calm her, but then uplift her at the same time, and sort of created a blend. And she is now a year after, it's been a little over a year since starting essential oils, and she has not been on a benzodiazepine in 3 months.
That's amazing.
I celebrated 90 days the other day when she was in the office of her not having to take a benzodiazepine, somebody who's come from war. And you would think that, hey, we need this, right? And so it's just amazing to see the benefit of it. And I would strongly encourage you to consider that. And I have success story after success story.
And there's a question about, did you publish your research?
Did I publish my research? Okay, so let's talk about this. As you know, FDA does not regulate essential oils. They're not on board with us. It is currently in the works for TOOT through the American Journal of Holistic Nursing. I'm just pending the publication approval, and then through the NLN. However, it is not published, but it has been presented multiple times. I can give you a link that you can go on and read the whole dissertation. Let me pull that up actually for you, because then you'll be able to read the whole study about copaiba, all of that. And then you'll be able to get all of the amazing research that I did and literature review that I had done for my DNP project. Let me just go back here. I will share that in the group with everybody.
Also, he's being very modest. He's also won awards for this research.
I
not share that part.
I did not. I have won awards for this research. And what's fascinating about it is that, the FDA doesn't recognize it, but healthcare in America recognizes it. And so we just really need to continue to work on that disconnect that's happening. It's sad to see, but it's also gives me hope in the future that it will start to become more mainstream, just like multivitamins have. And that, again, if that hasn't been your aha moment of this going, why don't we use essential oils? But we can pick up a multivitamin. We don't even look at the ingredients and we put it in our body. A lot of people go, oh, essential oils, I have to look into that. Okay, but did you drink your Starbucks, unicorn frappe this morning? Do you know what's in that? I mean, so if you don't have to look what's in that, then as a provider, I'm not going to tell you to put something in your body that's going to harm you. So sometimes we're met with resistance. But
hey, Dr. Chris, this is Jabbar from Herzing. I have a real quick question.
Yes, sir.
These past few years, there have been like a huge kick on this CBD oil, CBD treatment. What is your perspective on this? Because some of them are topical, some of them are oral, and it's like, what is going on with this big CBD kick all of a sudden?
Yeah, right. So what is CBD oil? CBD oil. Hang on one second. I have to log in to pull this. Erin, I'm going to have to email you if I can. I can email you my dissertation, and then we can kind of, the link to it. It's the password I have for the back end is not working for me to release it. So I will get it for you. What is my take on CBD oil? Well, what is CBD oil?
It's supposed to be the extract from the THC plant, correct?
Correct. Yeah. It is an essential oil. And mainstream America has adopted this essential oil, but has refuted 99% of the other essential oils and saying, that doesn't work. That's bogus. That's witchcraft. But yet they use CBD oil like it's going out of style. And they're not putting two and two together. What is my take on it? All right. So here's my take on CBD oil. CBD oil, pure CBD oil, contains no THC. So there's no hallucinogen in it. It has fantastic anti-inflammatory properties. I am a proponent of pure CBD oil. I don't want to get into the political debate of THC and where that stands in my philosophy, but I can tell you that, our primary goal is to do no harm. And I can tell you that if I am giving you something that scientifically will reduce inflammation, that is not going to be hallucinogen, that's not going to cause you to do things out of your normal capacity, then I am for it. And that's a personal opinion. That's not Herzing's opinion. That's my own personal opinion. But I want, you ask, so I will share.
I love how PC you are. It's great.
I try. Because people, this scares some people, and I have been met at the end of some of these presentations with some anger from people going, how dare you? How dare you? No, not how dare I. It's literally, it's common sense in my mind, but some people don't see it that way, that a multivitamin and what's in your multivitamin, right? There are extracts in your multivitamin. Where do you think they get some of this? Vitamin A. They didn't just come out of left field, so they put it in your multivitamin, you take it. But why is it not okay to take carrot seed oil in place of it?
So
but when you look at it, I'm sorry, but when you look at it, you have to realize that holistic medicine has been around since the turn of time. Pharmaceutical companies are really using holistic medicines for your over-the-counter and also for your prescription medications. So people just need to realize that they're just putting a price tag on it.
They're putting a price tag on it, and they're trying to figure out new ways to chemically produce it, right? When we think about penicillin and how we originally got penicillin, it came from mold.
Right.
But now we look at penicillin, and how do we obtain penicillin? Do we still get it from mold, or has science figured out a way to chemically reproduce it?
Absolutely.
Probably that.
So which would you rather have? Something that's chemically compounded and made up for you, or something that grew naturally from the earth?
I'll take my mold in the smoothie.
Right. But I mean, and some people are like, mold, that's gross. Well, how many of you eat blue cheese?
That's mold. Yeah.
Mold. That's all we're doing, right? And there's some huge properties to that. There's some amazing benefits to blue cheese because of the mold. It's insane. It's insane when we think about it.
So being a practitioner, we're pretty divided up here. It's usually like 60% of our students come from Illinois,
Sure.
40 to 50 are from Wisconsin. Obviously, Wisconsin is definitely more restrictive. There was a big battle to even approve CBD oil, and that is only medicinal at this point. Whereas Illinois has now legalized, and there's dispensaries for recreational and medicinal use.
Correct.
So how has that affected your practice at all that way? Like knowing that those dispensaries are available now for recreational medicinal, or no change?
What we're seeing, is not so much, I'm not seeing a change in if anything, it's a positive change to complementary alternative medicine, because I'm now able to leverage that, saying, if you're okay with this oil, then I need you to consider this oil as an alternative. So it gives me a little bit more leverage to say, if you can and you have have adopted the thought that this is beneficial for you, for anxiety, for whatever you're using it for, then this should be beneficial, because at the end of the day, the actual component of THC, right, or medicinal marijuana, the component that's the hallucinogen is the THC. The anti-inflammatory and calming properties comes from the CBD.
Right.
It doesn't come from the THC. So why do we need the THC? The THC is that feel good. Why do we need that component, right? And maybe we do need that component. I'm not going to refute that, but it has allowed me to have more conversation. Absolutely. But again, I go back to the most powerful thing I think that you can tell people is do you take a multivitamin? Many people do, right? Many providers have prescribed them in every state. And if they are taking that and you are properly educated and you can properly educate your patient, I would encourage you to start to have those small conversations. Start with family members first. And you will find your rhythm of how to explain that to people, and then how you can sort of relate that to your patients to build confidence in them. They can build confidence in you to kind of adopt this new way of thinking, right? It's a challenge. It was a challenge initially. Doing the research was challenging to get people to even be part of the study, because they're like, yeah, right. You're asking me to give this up to try something that is witchcraft. Like, you can back out of the study at any point. You can go back to what you were doing at any point during the study. There's absolutely no stopping you from doing that. But I will tell you, retention rate was good. And I think that is because of the way that the oils worked.
Where's your clinic?
It is in Crest Hill, Illinois. We literally can see Statesville Prison from our backyard. It's an odd place to be, but we chose where we're at based on need, right? We do serve in somewhat of an urban community. We do serve a very rural population. We're midway between your higher end of your Naperville and Oak Brook population to down in our Braidwood, Wilmington, Morris, into more of our rural farm areas. And we have patients that come from all over the place. I have patients that come in from Indiana. We actually were able to obtain credentialing with Indiana Medicaid so that we can see some of those patients. We take Medicaid. I realize that they don't reimburse as much, but that's not what I'm in this for. And so we really wanted to choose a place that was kind of central that everybody could come to. We've got patients that come down from Wisconsin and from Michigan. We've got a couple of patients from Grand Rapids that come see us every couple months. And why would they drive 4 hours to see their provider? I don't. And it, yes, I think it's a testament to all of my staff and to the clinic as a whole, not just to myself, because we do have 2 other providers. But I just often wonder, why don't we have more of us out there? Why aren't there more people that are offering what we're offering out there? And so that's part of this. Do insurance companies pay out for any of the services you provide regarding CAM, and do you use other alternative therapies other than essential oils? Yes, I do. So the first part of your question, do insurance companies pay out? Well, that depends on what you're asking them to pay out. Are you asking them to reimburse for the cost of the essential oil? Or are you asking them to reimburse for your time as a provider spent with your patient? That's the question. And so if you look at it in that regard, yes, I ask them to pay out for my time. I don't necessarily ask them to pay back the cost of the essential oil, because I know that it will be denied. And so it's in the chart. If they ever do a chart audit, it's there. I'm not hiding it, but I'm not going to request money for it. Which brings me to another baffling situation, right? B12. B12 is a supplement. It is not a pharmaceutical, but yet insurance will pay for B12. Where did I go wrong? It often makes me really wonder. And then, do I use other alternative therapies other than essential oils? I do. I do a lot of lymphatic massage in my office. I do acupressure. I do dry needling. I'll be cautious not to use any other words with that, right? Because they're, you know, let's face it here. I'll say it because it'll be the elephant in the room. Acupuncture. I do not do acupuncture. I do dry needling. And you ask what the difference is. Acupuncture can only be done by a master of acupuncture, and dry needling can be done by a qualified healthcare provider who's been trained. The outcome, research will show you that the outcome is very similar. But again, getting acupuncture covered by insurance is very, very hard to do. You know, we try, but because it's not acupuncture and it's dry needling, do they cover it? You build it into the cost of your time.
Do you ever find, and maybe it's not a great question, so do you ever find that it maybe sometimes for billing purposes, it's about like if you're treating a let's say pain management, but the treatment that you're actually using is for depression.
Mm-hmm.
You find that, you know, it's people have been able to get their treatments covered by utilizing techniques such as that. I'm not really sure how to word this properly.
Yeah. So treating two problems and we go after the one to bill on the one. Yeah. You know, billing is a political game in healthcare, and it's just disgusting. You know, we used to do that breakdown of billing when we started with the clinic. We have actually switched to time-based billing for the most part, because with time-based billing, only thing that's required is the time and documenting the time, and then having enough material evidence to support that time that you spent. There's a lot less kickback. There's a lot less frustration on our end. Do we make as much? No. But are we spending a lot less administrative time going back and fighting insurance companies? Yes. So there's a trade-off there. It allows me to see more patients because I'm not spending so much time doing chart audits and doing insurance reviews and that sort of thing. So you know, that's one way to approach it. That's how we've chosen to approach it in the moment. Hopefully, you know, over time we start to become more accepting of some of these alternative methods. And again, don't get me wrong, I still use my traditional pharmaceuticals. You know, the slogan at our clinic is medicine where East meets West. I definitely believe there's a place in healthcare for pharmaceuticals, but in the same breath, there is a place in American healthcare for complementary alternative medicine. One's not meant to replace the other. They just work differently. So what do you need to accomplish? And can something other than a traditional pharmaceutical be used, right? So you have to use a medicine, have to use a medicine. So often that's not the case. And we need to educate the public that's not the case, right? If they have a viral bronchitis, they still go and think they should get a medication. It's viral. There's no pharmaceutical out there that I'm going to be able to give you that's going to make it go away. I can give you stuff to kind of treat the symptoms, but I can give you many other things that aren't a pharmaceutical to treat the symptoms. So I encourage you to think about that as well. I'm working with a provider that's doing bioidentical hormone therapy. I also do bioidentical hormone therapy. We do implant in the hips. It is crazy insane the amount of people that are willing to pay cash for bioidentical hormone therapy. There is some tricks to getting it covered, but it is not very often accepted by insurance for coverage unless you really, really, really are skilled at navigating the political boundaries of bioidentical. I can prescribe you testosterone cypionate, 200 milligrams once a week for 4 weeks. As long as I can show that your testosterone levels are below normal, it's covered. Not such the case with bioidentical hormone therapy in the transplant world, but so much safer for my patients that I really had that conversation. I can give you this medication. You can pay $50 at the pharmacy every month, or I can inject these 5 pellets into you and they'll be there for 6 months and it's going to cost you $500. So about twice the price, but we don't have the risk of blood clots. We don't have the risk of stroke. We don't have the risk of cardiac events. Pick your poison.
Don't you think that's kind of like, if you could get that piece out, like, and be like, look, I'm not saying it's equal, but like, you know, listen to any, you know, Western medicine commercial, and it's like side effects may include, this, and there's a laundry list, and you're like, some of this is worse than what I'm treating.
Right. Absolutely. Especially with antidepressants and mood stabilizers and anxieties, anxiolytics. The side effects are almost more detrimental to your health than keeping the condition you already have. So yes, absolutely. And getting patients to pay for things out of pocket. We live in a society where we want everybody to pay everything for us, right? We want our insurance to pay every dollar of our healthcare bill. We shouldn't have to pay for anything for our healthcare. We've sort of groomed that culture in America, and it's really hard to undo that in some people. But I just explained to them, here are the benefits, right? Let's break down, if you've got seasonal allergies and we're trying to treat that, or you've got, chronic dermatitis, right? Atopic dermatitis, and we need to get the itching and inflammation. Well, if you're going to the doctor every 4 to 6 weeks because you're needing more steroid cream, let's talk about some oils you can use to kind of help desensitize. And are we going to save more money in the long run? Maybe, maybe not.
Where do you go to get like your certifications or training in the acupuncture and the dry needling?
So there are a lot of sort of continuing education courses out there. It's really controversial in kind of what we can do. And there's going to be a lot of people who are going to tell you, you can't do that. And that's not true. You have a license to touch and you have a license to treat. Where I went was through a chiropractic service because I hold a medical license and was able to go that route. But if you try to get into a physician's dry needling course that's meant for medical doctors, they probably won't accept you into the course. So it's finding where it's at, right? And which certification is the one you have to have? The answer is there isn't one. There's multiple certifications. Why do we get certifications in healthcare, right? We have to be board certified to practice because the state says it's so. And it's different state to state, which, we're trying to do compact state for all 50 states for registered nurses. And eventually at some point, I think that will start to expand to advanced practice. But we've got to start at the base first and get the registered nurses on the compact, and then we can start to advance it.
Illinois still won't join. It's cool.
I feel like we're so far behind because the American Medical Association is based out of Chicago, and we just have the biggest lobbyists and the most money to spend. And it's again, political.
Right. I was like, Amy's over there in Ohio. It's very strict over there too.
Yeah. Ohio is a rough one. It's so getting that certification. If you look up dry needling certification courses, you're looking for ones that are open to chiropractors, and then you usually will be fully accepted into those. And the reason we get these certifications is because if something were to happen or go wrong, and you are to be, and someone comes after you, either after your license or after you financially in a criminal case, you have to be able to prove that you are proficient and had proper training. And that is where your certification comes into play. Okay. As well as some insurances, if you're going to seek reimbursement, some insurance companies require certain certifications to be held. I am the only reason I am licensed or getting reimbursement for substance abuse treatment is because I have the SAMHSA training. Without the SAMHSA training, even if I were to write buprenorphine, as now the former President Trump signed on his last day in office, that any provider can write for buprenorphine for drug management. Any medical doctor or DO, nurse practitioners are still required to have SAMHSA training, but they're no longer required to have SAMHSA training. Well, if insurance stays the way it was, only people who have the SAMHSA training will be reimbursed for their services. So that'll be an interesting thing to watch play out over the next couple months as to, are providers going to start writing this? And I can only imagine that the lawsuits that come from accidental overdose deaths from being properly managed, I can only imagine what that's going to cost. I still think that it's very important to have the specialized training for that. And again, for these, but again, some certifications you need to write certain medications, some certifications you need to do different things. I don't need a certification in essential oil use in clinical practice, but I have one in the event that I ever needed to rely on it. I hope that answers your question.
Jamie's got a question in there about encouraging working with traditional healthcare
setting. All right, so essential oils within patient care. So the first person that you want to kind of get buy-in from my experience, is your direct supervisor. If your direct supervisor is not on board, you're going to struggle to get it put through administration. I would also encourage you to come armed with all the evidence you can, which might mean reaching out to some of these hospitals, to Mount Sinai out in California, to a couple of the hospitals in New York, New Jersey, and Hoboken. There's one. Reaching out to those hospitals and asking to speak to their clinical nurse educator, and asking them for their resources and their data, their patient safety outcome data, with the patients who have utilized that in their clinical setting. Because when you go to your boss, you want to be able to sort of explain what the benefit is to the patient. We don't want to focus so much on how did we keep the patient safe, although that's a crucial component. We want to state, this is how it's going to help them, and this is what happens when we do help them, right? Here's the data saying that there's no harm being done because we're helping them. We're not just adding it in there just to add it in there for fun, because again, it's more work and more education and more training. What does that education look like to the nurses in the hospital? Is it part of a skills day? Does it have to be a whole formal in-service? What does that look like at these other institutions, and kind of how will that affect what's happening at your institution? So yes, definitely, I encourage you to work within the traditional healthcare system. That's how these healthcare systems have started using these things. But come armed with research. Don't come armed with, hey, I heard this presentation about utilizing essential oils in critical care in the ICU. I think we should really do this. They're going to go, nope, right? Because they've got nothing to go forward with. Where if you come armed with information and research studies, there are hundreds of them out there. So many people think that there's really not a lot, but there is thousands upon thousands of essential oil research. It's not all coming from the United States, and that's okay.
Right. And remember to utilize the resources that you have. Like, so if you're enrolled in school, find the librarians to help you find those accredited studies, and like where you can, yeah, it's like you've got resources. Even if you're an alumni, you can still utilize any of your resources at any of your schools to find this research.
Absolutely. Absolutely. And I will tell you, the most powerful thing is to make yourself vulnerable and contact those institutions that are already using them. It's going to be a very awkward phone call at first. You're going to be like, I don't even know what to ask them. And you just say, hey, I'm a nurse, and I heard that you guys do essential oils with your patients in certain settings. I would love to know a little bit more about what your policies and procedures are for that, so that I can take this to our management. They aren't proprietary. They're not like, oh, we're not going to give you our information. Because again, we're not stealing from the market. We're literally trying to put patient outcomes ahead of anything. And so they're usually more than willing to give you what they need, or what you need, or what you're requesting, as long as it's appropriate. They're not just going to hand you every policy and procedure that they have written, or their intellectual property, but they definitely will give you the why behind the what. What research did you guys utilize? Where did you go? What certification did you offer to your nurses? How did the training look like? They will tell you these things. You just have to ask.
And then probably to close, it looks like questions are winding down, which is good.
Yeah, sorry. I know we've gone a half hour over. My bad.
I'm fine. This is your time. Can you talk about the path that you took? Like, so we were talking earlier, and you're like, you started as a life coach before you were even a nurse. So like, what pathways did you take and get to where you are now?
I started as a life coach before I became a CNA back in 2003. I was a CNA from 2003 to 2008. And even up until really 2012, I started nursing school. I got my undergraduate. I started that journey. Let me take a step back, because I started that journey in 2006, 2005, 2006 in Florida. And I was going to a university that was not accredited, and didn't know it, because at the time I was young. I didn't know what I was looking for or what I needed to know about this whole accreditation thing. I just thought, hey, it's a nursing program, let's do it. And so I started to do it. I chose nursing initially because my grandfather was passing away from bone cancer and he was miserable. And the hospice nurses, some of them are great and some of them, I'm not sure that bedside care, especially in hospice, was their calling, is the nicest way I can put that. And I said, I'll never let somebody go through that again. If I can make a difference in anybody's life so that they don't have to go through that, so their families don't have to go through that, that's what I was going to do. And so that's kind of what pushed me into this field. So I started there. I went through, I was starting my senior year of nursing school in Florida and said, hey, I want to go back to school. I want to go further. So I started applying at other places, only to come to find out that they would not accept my degree. And so that brought me back to Illinois and I restarted and graduated officially in December of 2007 with my bachelor's. From there, I went to Christ Hospital in Oak Lawn. I worked in open heart surgery. I was an open heart OR nurse and transplant nurse, and did that for some time till the call burned me out. And then that led me to cardiac ICU, which then led to a little bit more stableness in my personal life and was able to move. Well, when I moved a little bit further than I anticipated. So I had to change facilities. But with that change came so many more opportunities for me. I was able to cross-train to the neurointensive ICU and to both med surg as well while still doing cardiac. So I was able to cross-train to that, got to know a lot of people, networked with a lot of people, which then put me in a position to get into sort of a float pool where I was then cross-trained to the ER. That was in 2012 is when I started to cross-train. I was working every unit in the hospital as a float nurse and I did that from 2012 to 2015. In 2012, yeah. So 2012, 2015, when I started and then I said, I want to do more. I've done the bedside thing. I want to do more. I want to see these people go from here and I want to watch their journey to here. And I couldn't do that as an ER or an ICU nurse. I saw them when they were very sick. I saw them when it was an emergency, but I never knew the outcome. And that always drove me nuts, to never know the outcome. I'm a very inquisitive person. So I did that. And then in 2015, I decided now's the time for me to go back to school. And with that came an opportunity to be an assistant manager of the float pool. So I was the assistant manager of just over 300 nurses and just over 200 techs. It was a big unit. We were in a big 550 bed hospital. It was intense. But they knew I was going back to school. They knew that I was working towards getting my FNP, and they were very supportive of that. So they were very flexible. They allowed me to do some evenings and some weekends, being part of management. If the manager was there during these hours, then it would be okay for me to be there in other hours. Now I had to kind of sell that to them initially, saying there's more presence of around for me to do those things. And they said, sure, why not? And now they actually are continuing to do that, even though I'm no longer there. They're still having the assistant managers work off hours of the managers, so that there is more administrative presence for these nurses, which is a huge help in most instances. So I did that. And then I became a nurse practitioner in 2015. And I said in 2015, I'm already almost there. Let's go back and get my doctorate. And so I decided then that I was going to do it. It took some time for me to actually commit, but I did start my doctorate program in 2017.
Oh no, Chris froze. Hey, Chris. Right, he's frozen, not everybody. I feel like I still see people moving, so we're good.
I'm still here.
All right, so nope, that was him. Good. I just want to make sure. I was like, it's not my computer. I just want to make sure it's him, and he'll click back in real quickly. I was like, I can still see Lisa like looking back and forth. So I was like, okay, she's not frozen, I don't think. I was like,
I think you missed your calling as a nurse. You should have been a reporter.
I know, right? You know what? I actually met Chris at a gala for the Illinois Nurse Foundation, and heard him speak about his dissertation, and he was so passionate. Like I was instantly like, I was like, I got to get this guy here. Hey, welcome back.
The internet went down at my house, so now I am piggybacked off the wireless, my hotspot on my phone. So if I'm choppy, I apologize. But you can hear me, yes?
Yep, and you're not frozen.
Okay. All right, perfect. So I became a house operations administrator at that same hospital, which was not at all what I thought it would be, but it definitely provided me with the financial and administrative and business aspects of healthcare, because there's so much involved in being a house ops admin, and it was such a learning opportunity for me that I think that gave me the confidence to continue to pursue my dream. And as I was working in addiction medicine, I said, there's more I can do. There's more I can do. And what can I do? And so sit down and you start writing things out and thinking about things. And just 2 short years after I started in practice, I said, you know what? Now's the time. Now's the time to change, or be a change, I should say, in the face of healthcare. And I said, if chiropractors can open their own offices, and dentists can open their own offices, and medical doctors can open their own offices, so can I. And so I did. And it is the scariest thing I've ever done in my life, because my whole life savings went into this, blood, sweat, and tears, not knowing where I'd go next. And we opened in September of 2017, and we had 9 patients my first month. Yes, 9. You heard me, 9.
You were busy.
I was scared out of my mind, right? But I believed in what we were doing, and my staff believed in what we were doing. And the very few patients we had believed in what we were doing, that we were going to bring healthcare back to the community, and that we were going to educate our patients on what they can do when they're not at the provider's office, so that they don't have to rely 100% on us, so that they can learn to rely on themselves. They can learn to get that education component. And that was really kind of a foundational piece of what we wanted to do, was education, because that's so often missing. When I was doing addiction medicine, I had 7 minutes with every one of my patients. You can't change lives in 7 minutes. I shouldn't say you can't. You can. I'm absolutely sure that I did, but it is much more challenging, and the burnout's real. When you're seeing 30, 40 addiction patients a day, and you're trying to impact their life in a positive way every time you see them, that gets challenging. So we kind of, said, we're going to do this different. And we did. All the meanwhile, and all of that, I also did 10 years in the United States Army. So that, I was active for a hot minute in between my RN and my MSN, and then went reserves. And so here I am. I just actually got out of the reserves this past July. It was supposed to be before that. I originally was supposed to be out in August of 2019. But with everything going on politically and in the military, when you're an officer in the military, especially in the medical corps, where there's not many of us, they don't like to let us go. But I knew, for my patients, for my family, and for everything that I had, that it was time for me to retire from the military and move on to the next chapter. So here I am, loving life, loving every minute of it, looking forward to the next step in my journey, which, like I said, I've been doing addiction medicine for about 6 years. And along with addiction medicine comes psych. They go hand in hand. They really are married. And I was trained to do it, but I do not have my postmaster's cert in PMHNP. And so that is actually the next step in my journey. I don't know that I'll ever stop going to school. I think school is challenging. There are times when I absolutely hate it. I will not lie. I've been in school for 17 years. After high school, I'm tired. But at the same time, if I don't get this, am I potentially not working and not delivering care to the best of my ability? And so that's what's kind of giving me that drive to say, I got to go back. I gotta go back. And, my family's not very happy about it. They're like, no more school. But it's my life's mission. It's my calling. And that keeps me going.
Hey, Chris, this is Jabbar again.
Yes, sir.
First of all, thank you for your services for the country.
Absolutely.
And I worked for a hospice, I would have to say about 10 years ago. And they were actually using holistic oils and everything for, it was actually Heartland Hospice.
Mm-hmm.
And they were actually using holistic oils and the aromatherapies and all of that. And that was like 10 years ago. And they were so adamant on trying to get people to get on the bandwagon. So I am like a self-testimony to see how it really worked. It truly, it worked for the hospice, even with their chini stoking, it really worked.
Yes. And, one of my employees, her father was going through lung cancer, and we couldn't get him to quit coughing to save our lives. We couldn't get this gentleman to stop coughing. And with that said, I said, well, I know that you haven't been a firm believer of oils. You're interested in them, but you're not, it's kind of like we use them for some things, but they don't work for everything. And of course it couldn't work for cancer related complications. And I said, I just want you to give me one day, just one day. Nothing was working. Tylenol with codeine, nothing, Cheritos, nothing worked for this cough. And we did one oil. It was called Raven. It's a blend. It's a proprietary blend that's by Young Living, to be very honest. But he didn't cough all night. And it was the first night he slept in months. And so that's, to your point, it is so powerful. You just have to know what oils are used for what. That is where we lack, and sort of come to this point of, I can't promote oils because I don't know which ones to use. And the reason they don't know which one to use is because there's a lot of research out there on so many oils can be used for so many things. There's no textbook that says you use this oil for this, right? With traditional pharmaceuticals, we use beta blockers for blood pressure, but are they? Are beta blockers only good for blood pressure? And I would challenge to say, no, that's what we prescribe for stage fright. People who are actors who get very anxious, we're going to put them on a beta blocker right before they go out.
Wow.
Help calm them down. Yeah. It's interesting. Now, is it FDA approved? There's some argument. Huh?
So beta blockers are. Is it approved for what you're treated for? I don't know.
So there's different guidelines, right? Some people have said yes, some people have said no. There's parameters. Obviously, they have to have control of their blood pressure so that we don't bottom them out when they take it. But if they're doing it in small doses, just to help kind of slow the heart rate down, bring the blood pressure down a little bit so that anxiety doesn't, kind of trigger, it works. It works well. I have to take it when I stand up in front of people to talk. Doing videos like this, I don't, but when I actually stand up, if I don't, my knees will buckle and I will hit the floor. It happened at a graduation speech once, where I buckled and fell into the podium. I didn't hit the floor, but I fell into the podium, and it was embarrassing. And I was like, I got to do something about this. So just for the last about year and a half, 2 years, I've been utilizing it just once in a while. I don't have blood pressure issues, but yeah, and that's where I learned it, because I was going to places there's got to be something out there, right? I use essential oils most of the time, but there are times when I'm in front of big crowds that it gets challenging. I spoke at a couple conferences that I tried one with just oils and it helped, but I needed the medication, which is why I say that there is a place for traditional Western medicine.
Right, because they're even using it even in the baby lotions. Like you have like the Sleepy Time baby lotion, the Sleepy Time baby shampoos, and all of that.
Yes. Yep. Absolutely. So I will get that. I will get my research over to Erin so that she can kind of put that out. And one of the things, and I like my research. Don't get me wrong. I don't think that it is earth-shattering. But what I think is the most valuable resource out of my research is my literature review. I do have to say, I think that my literature review and the articles that I utilize to do my research have so much power and will open your mind to so many new opportunities that I couldn't even get to with my research, but wanted to include as much as I could of evidence-based and where it goes. And it talks about other oils and the research is focused on those three, but my whole dissertation or project paper talks about everything from oregano oils to citrus oils, and so you'll learn a lot, and the resources are great, and that's where a lot of certification resources are as well, because we talk a little bit about what's next in healthcare if we were to implement this. So
definitely. So I'll send that out as soon as he gets it to me.
Yes.
Otherwise, thank you so much for being here. You're amazing. I knew you would be.